Thank you very much, and thank you for inviting me. I think I'm the only non-military person here, and I'm really honored to be with folks who have given and continue to give so much. I do occasional proctoring for Intuitive, pretty much only within our own system. And I want to kind of expand on Ukraine a little bit and put it a little bit in a perspective from a non-military standpoint. So to give you an idea, as of February 19, 2022, in Ukraine, it's a middle-income country, one of the biggest in Europe, yet pretty resource poor, government-subsidized healthcare, but the trust in the healthcare is not very high. Close to 30% of folks either seek second opinion or get their care in private clinics. You know, capitalism, it still works. If you kind of put up your own money, you probably have more control, potentially some better outcomes in certain things. And you rely on individual referrals. You're not going to Cleveland Clinic. You're going to that person who knows that person, and that's how you're going to ensure that you're going to get a good care. And the medical education is an older version of kind of apprenticeship. So there is a system that will put trainees in the different institutions, but really somebody has to take an interest in you and put you under your wing, so for you to get well trained. To give you an idea, probably less than half of people graduating from medical school actually practice medicine. And oftentimes what it's end up being, all of that ends up in a situation where people actually don't oftentimes want to train. It's not everywhere. There are a lot of good places for train good physicians, but you practically, in a lot of places, you are training your own competition, which is obviously not a great place to be. What you're going to find is a very wide range of skills and equipment. You have places that barely have enough energy devices beyond electrocautery, and you have folks who will do really, state-of-the-art advanced laparoscopy and robotic surgery. It can work in any clinic in this country, and they're going to do great. So all of that changed on the February 20th because immediately after the attack, everything other than kind of a war-related stuff stopped. So meaning all the surgeries planned were told to stop. Cancer surgery, urgent surgery, and then in addition, everybody scattered, right? The patients end up in one place, the physicians ended up in a different place, and then oftentimes their care is somewhat fragmented. So for example, ortho trauma hospital will not have general surgeons. So if you need something, vascular general surgery, you're going to call your friend and they're going to come over, or you're going to move a patient, and all of that stopped as well. So in addition, kind of another perspective of it is they're still making progress before war in Afghanistan, and they keep on kind of moving along, but oftentimes they would rely on going and taking to conferences and master classes abroad, or people coming in and helping out. So it's kind of sporadic, kind of a little bit at the time. And also that all stopped almost overnight. So this is actually on the right is a picture from the first time we went in 2022. This is an operating room in Uzhgorod, which is on the border with Hungary. And we brought the LigaSure device, in which we shared between the two operating rooms in this OR. We literally will unplug, move it over, replug, and then keep working. But what it did, it kind of provided an opportunity. So it started out as essentially we said, well, right now we are lagging weeks and months in cancer care, and the resources are still being limited, but we can actually go and help. But what kind of a help can we provide? I'm not a trauma surgeon. I wouldn't know what to do, but I do know MIS, I do know cancer, that stuff we can do. And then this was combined with kind of some of the government regulation relaxed a little bit. The fact that we were coming in and bringing stuff, we could actually tailor and say, well, we can help you with cancer, but we can also help you with laparoscopy, much more than just putting up a class we could actually, I'm actually going to go back for a second. We could actually, tailor and do surgeries together rather than us kind of showing off how we do it in Chicago. And that kind of created, I think, an opportunity that otherwise would have taken us years to come. And then there were other things that helped. But the previous kind of, and yet an ongoing disaster of COVID, allowed us, telemedicine became a thing, right? So it started out with a very much grassroots efforts, but, at that point, if you're calling me in Chicago, it's the same as calling somebody 2 blocks away because they still cannot walk over, right? So all of these, organizations and companies started to kind of, pop up and then pivoted towards providing this support and care just, by phone, calling somebody and saying, well, what do I do with this, right? How do I do this? And then when we came, again, we were actually able to start operating together. So we created these joint teams when we would do laparoscopy together. And this is, again, the advantage was at that point, these are people who already know oftentimes a fair amount. So it's kind of like showing them tips and tricks and switching places with them so we can do things together and then kind of advancing what they do. And then as also in this country was a significant amount of support, we were able to get permissions oftentimes, but it would take me like a year to do prior to bring people over. So instead of kind of this periodic, like we're going to do something, there's going to be a break, do something, we could actually bring people over to us so they can keep on seeing kind of this is how we do things, this is before, this is after, and this is how, in this case, we switch things a little bit over compared to the next case. And I think this is actually bringing us to the next step in allowing this continuous. I'm going to put a little plug for this company. It's called Proximate. It was actually started by a plastic surgeon, and their devices plug in and capture images for pretty much any source, from any kind of a laparoscopic, robotic, even open devices. They provide a little camera. It goes in a little suitcase. I'm bringing 3 of them with me in June to Ukraine. But what that means, so instead of waiting and saying, hey, next time we come, we're going to have a case, we can now plug it in. I can sit in my office and I see exactly what they see, right? So when they booking these cases, we can actually say, oh, you know what, I would put another port here. Here, I would use a clip instead of energy device. So they can keep on going and progressing in what they do. And again, with all of this, I think another big thing that that came out of it, and I'm going to start at the bottom of the slide, is because as people kind of scatter and some of regulation release, some of the younger folks and the next generation that oftentimes, remember what I said in the beginning, was kind of competing with the people who were training them, they got a little bit more liberty to start doing stuff. They're eager to learn, they're eager to help their patients in their country, and that kind of allowed them to kind of start pushing with more new technologies and more things to do. And so one of the things that came out of it, for example, in Ukraine, I think prior to war, there are 2 what we would call trauma centers in this country. Right now, there are multiples, right? Infections that was already, the rate was up to about 25% in some places, and that just skyrocketed because of all the injuries, right? So, and all of a sudden, there was an interest in both patients, providers, government to actually start, well, how do we address it? How do we institute this quality improvement projects to do? And I think very importantly, at least in the beginning, when we were starting bringing people over here, just people who were able to leave a country were mostly women. And it's actually kind of gave them a leg up when they go back and take a lead in some of these projects, because they could actually come back and say, I actually kind of know what to do and I know the technology behind it. And they started to put this in, and I know this is from a U.S. educational standpoint, this old model of, see one, do one, teach one, but actually in this setting, I think it works extremely well in combination of all these pieces coming in together to kind of push the whole healthcare system and healthcare education forward. And I actually want to put a little plug for enterostomy care. So I spent years trying to talk to him about, we need to start setting things up, we need to do things, and the answer was always no. And the thing is, all of a sudden, they're doing this, damage control surgery. They have all of these civilians coming in with abdominal wounds because they don't have vests to protect them. And all of a sudden, this women surgeons are coming in and saying, hey, can I actually follow your wound and stoma nurses? Because we're not really sure what to do. So we use that. We brought back with me were two APPs who are stoma nurses came, and we were putting up the workshops, like the first ones in the country for wound and stoma care, bringing the patients, bringing the providers, actually teaching them what to do and starting setting things up. So kind of altogether, it's a horrible tragedy of what's going on. But I think the silver lining that I see in that is that there is this new generation who is very much interested in kind of advancing things and advancing medicine. And actually, I think ironically enough, like the MIS surgery and everything has been one of the biggest benefactors in that, because it's kind of meeting people where we are. I did put my email in there. We're going back. If anybody is interested in joining and helping, I'll be happy to chat. And thank you again for inviting me.